this is the Tidor. It's a really nice piece. It's a great piece. It's 2025, and I think maybe it's the future for 2026. And you can see here, it's possible to know the IRP. This is very important. Also, this technology could control the pressure, intrarenal pressure, and also the irrigation, and also this technology could control the suction. This is absolutely impressive. There are 1, 2, 3, 4 functions in the same technology. This is completely new for Europe, and I am so grateful to the company YiGaoMed, and I have here one of the representatives, please, this Kulison, and also they come here from China, and also Grace, also from this company. They come here especially for this meeting, especially for this this is Tidor, this is Elephant 4. I mean the new one. This is really the first in Europe, the first used in clinical use in Europe, and you can see we already put it this, and you can see already he's in the pilot system, and you can see it's already, this is the urine. I told you it's Elephant 4. This is really great because this access sheet, plus and minus, this is very important because you can see here it's possible to have your IRP. I mean the irrigation is here, and also the IRP is controlled. This is absolutely impressive. This possibility. Look, IRP is 1.6, very low, and you can see the irrigation and also the suction. It's automatical suction. This is a great technology.